So, dear friends, today I will going to teach you a very important remedy. In fact, it is a remedy which generally overlooked, but I have used many times in my practice. This remedy is the Symphoricarpus racemosa. What happens when we treat the morning sickness? We generally think of Naxomica, we think about Ipecac, sometimes we think about the sepia, we think about the colchicum, but one forgets the organ remedies. In my 30 years of practice, I have many times in fact used the Symphoricarpus racemosa. It is too specific for the morning sickness. So why not to study it from the Borix Mathematical? So just now we have used with one patient. So let us learn about this Symphoricarpus and let us learn what he says about it. So open your Borix Mathematical and just see what he says. Symphoricarpus racemosa, it is snowberry. So this is plant remedy, sensitive remedy, but not so well proved remedy. So this drug is highly recommended for the persistent vomiting of pregnancy. Whenever Borix says in the first sentence, it has a lot of meaning. Every remedy, whenever you read from the Borix Mathematical, the first sentence defines the action of remedy. If you are opening the natrum sulph, he explains over there that it's a liver remedy. So that defines the action of natrum sulph is specifically on the liver. In the similar manner, when he writes about the Symphoricarpus, he explains it is a remedy for the persistent vomiting of pregnancy, so which is not getting settled. That is the problem with Symphoricarpus. Borix Mathematical is most practical Mathematical from when I consider in my practice. Every remedy he has defined in such a manner. If you open your remedy, for example, we'll take an example that just open palladium. What he says, first sentence, it's an ovarian remedy. You open the sentence, he starts with the sentence, it's an ovarian remedy. So he defines the action, the remedy is having very specific relation to that part. In the similar manner, when he thinks about the Symphoricarpus, the first sentence is very important for the persistent vomiting of pregnancy. Gastric disturbances, fecal appetite. Fecal appetite means restless. Sometimes patient wants to eat, sometimes he never wants to eat. Capriciousness is there regarding the vomiting, regarding the appetite. So sometimes they are hungry, sometimes they are not at all hungry. They never wants to eat. Nausea. Water brash. What is water brash? In Marathi we say it garalena. So water brash is nothing but the whatever is ingested, the some amount of it reflux or it comes in the mouth and again it goes down is called as water brash. So water brash, bitter taste in the mouth. This is too important. And another feature which he has mentioned over there in italics is constipation. So, morning sickness associated with constipation, don't forget a Symphoricarpus. In fact, I will suggest that first use the Symphoricarpus blindly. Then think of any other remedy. If you are busy practitioner, this is too important. I have not failed with Symphoricarpus. Nausea during menstruation. This is again one more characteristic feature. Sometimes patient comes, doctor, every time I get the menses I feel nauseated. This is one important feature of Symphoricarpus. Nausea works by any motion. So whenever patient moves, the nausea increases. Whenever we think of the nausea, another remedy should come in our mind is Ipecac. Constant nausea with each and every complaint is Ipecac. But we can differentiate Ipecac very easily. In Ipecac, the thirstlessness is characteristic. In Ipecac, the clean tongue is characteristic. In Ipecac, there is direct irritation of the pneumogastric nerve is there, and that's why all of a sudden the cough or increased cough secretions are there in Ipecac. So Ipecac is very easy to differentiate from the Symphoricarpus. averse to all food. What he says? Aversion to all types of food. Patient always talks, tells you, or patient's relative tells, she never eats anything, everything. She says, no, no, no. This is the problem with the Symphoricarpus. And this is quite common in the first trimester of pregnant lady. Better lying on back. So patient feels better whenever they lies on back, their nausea is better, morning sickness is better. As soon as they sit, immediately the problem starts. Dose. Dose is second and third potency. 200 has proved curative. So Symphoricarpus racemosa, my experience is that I used to use it in 30 potency, generally in repeated doses, and it helps definitely. Very occasionally you might require 200, and 200 also you can repeat in such cases, and it is the sure shot prescription for the morning sickness. So don't forget the Symphoricarpus in your practice, and always these organ remedies which are mentioned in Borix Materia Medica, they are very helpful. When you try and when you experiment, it is too important to experiment. I have experimented and I found it very useful, and I am using off and on. Even my wife, she is using sometimes Symphoricarpus. If she never gets results with allopathic medicine, she always asks for homeopathic help, and she asks to prescribe the Symphoricarpus. This is too important in the morning sickness. So this is a short remedy we have discussed today. Some other time another remedy we will discuss. Thank you.